Medicaid matters for Missouri. It's about our health, supporting our healthcare system, and getting value for our tax dollars. Missouri falls in the lower half of states for health status. The bottom line is Missourians are, on average, poorer and sicker than most Americans. Contributing this, in part, is the fact that hundreds of thousands of Missourians don't have health insurance. Many of these Missourians are the working poor, who labor at low-wage jobs that don't offer health insurance benefits. Missouri's current Medicaid program doesn't cover low-income working adults unless they have children. For a single adult, there is no coverage through Missouri's Medicaid program. For a parent to qualify for Medicaid, they must earn no more than 19% of the federal poverty level. A single mother with one child would have to earn less than $3,000 annually to qualify. The Affordable Care Act mandated that states provide Medicaid coverage to their working poor, those making below 138% of the federal poverty level. Who are these Missourians? They're people you see every day. They may serve you coffee or work at the construction site you pass to get to work, or they may take care of an elderly relative, or be the person who checks you out at the local department store. The state mandate to cover low-income Americans through Medicaid was ultimately struck down by the U.S. Supreme Court, and subsequently, states have been given the option to cover their working poor through Medicaid. Since Missouri has not adopted a Medicaid plan, the working poor are stuck in the gap, not poor enough to qualify for the current program, and too poor to be eligible under the federal law to gain access to credits through the health insurance exchange. Although a majority of states have expanded their programs, including half of the states bordering Missouri, our state has not adopted a Medicaid program. Whether these Missourians have coverage matters. First, we all pay the cost of the uninsured through higher rates. When the uninsured get care at a hospital, some of that cost is shifted to those with insurance. Think of it as a hidden healthcare tax that you didn't realize you were paying. Second, as taxpayers, we're already paying for Medicaid expansion. We're just not getting the coverage. The Affordable Care Act didn't increase federal spending. It cut payments to providers to increase coverage. So in states that have not adopted a Medicaid expansion plan, the cuts are still taking place, but the coverage isn't appearing. That hurts the system that provides your health care. In Missouri, hospitals have closed, services have been reduced, and jobs lost because of the cuts. Doing nothing is an expensive choice. The longer lawmakers wait, the more it will cost the state to participate. That's because the federal government picks up a larger share of the cost in the first years of the program. However, the match rate is fixed at 90% federal after 2020. That means that for every $1 of state investment, the federal government will contribute $9. Taking action now will allow lawmakers to maximize the value of the federal contribution to the program. Missouri could create a trust fund from savings to safeguard its budget while still expanding coverage. Two of our neighboring states are already seeing significant state savings that could offset the cost of their programs for the foreseeable future. Kentucky, Arkansas, and states throughout the nation are investing in the health of their communities, strengthening their healthcare systems, and bringing their tax dollars home to work for them. Missouri can and should be doing the same thing. Every Missourian has a stake in the Medicaid expansion discussion. Weigh in with lawmakers, share this video, or write a letter to your local newspaper editor. Together, we can make a difference in moving Medicaid forward.